Up next on Time for Living, getting the health care you need in your own home.
In our second effort salute, meet the man who has become Smokey Bear's guardian.
And we'll be taking you to Portugal, Spain, and Morocco. All this and much more next on Time for Living. Trailer.
And I'm Janet Jagalian. Thanks for joining us again on Time for Living, a new show airing every Wednesday afternoon right here on New England Cable News.
On this show, we want to help you live life to the fullest. And if you're approaching retirement age, or if you're already retired, there's no reason to slow down.
There are many more challenges and endeavors waiting to be done, and you can do them.
Of course, to accomplish these goals, you have to stay healthy. And while we don't have our total health under control, we do have the ability to take the necessary precautions to keep from getting sick. One of these steps is to see your doctor regularly. Now, most older Americans are in good enough shape to make it out to their doctor's office for regular visits, but a small number of folks have not been able to get to the doctor's office. In fact, it can be a large effort just to get out of their homes. Now, Time for Living Steve Brown tells us of one program that's bringing back long forgotten traditions. Physicians making house calls, would you believe?
Dr. David Barron is on his way to see a patient. But Dr. Barron won't see that patient in his office, nor will he see her in the hospital or at a clinic.
Hello, it's Dr. Barron.
Dr. Barron is seeing Pauline Hollingsworth in her own home. Mrs. Hollingsworth is one of 200 homebound patients under the care of doctors and nurse practitioners in the Cambridge Hospital's House Calls program.
Well, I think you're just about exactly as I remember you.
For Mrs. Hollingsworth, leaving her home for a doctor's appointment would be a great struggle. To have the doctor come to her means she gets the preventative health care she needs while maintaining dignity and independence.
For one thing, it's meant that I didn't have to go to a nursing home or to a retirement home. I enjoy being in my house with the diversity of people that come and go here.
Among the goals of House Calls is to provide needed health services, to prevent hospitalization or institutionalization, and prevent loss of self-esteem and dignity. House Calls was launched 7 years ago and offers a team approach of medical, mental, and social services.
Our whole approach to providing health care in the home is that it's a very multidisciplinary approach that's very attentive to the wide range of needs of the patient. So for the doctor to have the time to just spend on all the details of someone's life is virtually impossible in the way we practice medicine these days. So it helps us have people available that can really pay attention to all the needs of the patient. And nurses tend to have a different perspective than doctors, so they notice things differently than what we notice, and they pay attention to things differently than what we notice. So we think that us all working together as a team gives really the optimal care for people in this situation.
Patients are 60 years old or older with mental and physical impairments, which makes traveling to a doctor's office difficult or impossible.
I would hope that if they don't have home care in all of our states, they will start working on it really comprehensively, because we need it in all the states. It's so wonderful to have it in Massachusetts.
For the doctors taking part in the program, it offers a perspective not seen from the doctor's office.
I think, frankly, it's what makes it so enjoyable. Going into someone's home, you really much more quickly get a sense of what they're like. And the dynamics of the doctor-patient visit is very different. I'm on their turf, I'm in their home.
For most people, staying at home is very important, and we try and help people do that.
Dr. Susan Hart is the medical director of the House Calls program.
I think we're really just serving the tip of the iceberg. I think there are many, many patients and people living in the community who really could use our services and who don't get them for a variety of reasons. They don't know that we exist. They're afraid to go to the doctor because they're afraid we'll find things. And I think that's another thing that we do, is we tailor our care to respect the elder living at home and to try and keep them living at home. Our purpose is also to keep patients out of the hospital and out of nursing homes. And we're willing to sort of compromise with patients or work with them to get them the care that they want in a way that's not threatening to them.
The program has been receiving high marks.
The feedback has always been very positive. You know, when you're old and isolated and the phone doesn't ring as often and your family has moved away or you've outlived your siblings, it becomes really hard. And what we're able to do is provide a lot of that socialization and provide the contact that's needed to maintain somebody in their home. And that's a really vital piece and a vital connection for a lot of people.
Mrs. Hollingsworth got a good report from Dr. Barron. A nurse practitioner will keep tabs on her until Dr. Barron sees her again.
Bye-bye now, Ms. Hollingsworth.
Bye-bye, Dr. Ballard.
I'll see you next time. Take care.
Hopefully, still in the comfort of her own home. I'm Steve Brown. Time for Living.
Joining me in the studio is Dr. Alan Abrams, Director of the Geriatric Division at Cambridge Hospital. He's founder of the House Calls program just featured on Time for Living, and he's founder of the National Institute of Community Care. Dr. Abrams was also named the National Home Care Physician of the Year in 1994, and most recently he was elected to the Board of Directors of the American Academy of Home Care Physicians. And in just a few minutes, we'll begin taking your calls at 617-244-3344. So pick up the phone and give us a call with your questions or concerns. You can begin calling anytime. Dr. Abrams, it's wonderful to have you here, and I have to admit, having had a background in physical therapy and rehabilitation and having knowledge of the fact that a small percentage of our elder population goes to nursing homes, but the greatest fear they have is having to go, that doing this kind of home care health has got to be one of the most important marks that have been done in health care for the elderly in years.
Well, it's not just one of the most important things in healthcare. It's a very vital thing for people because we hope to enable people as they get older to maintain all of the interests that they have and maintain all of the things in their lives that make them vital, while at the same time taking care of some of their medical issues, their chronic medical issues. So we see it as enabling people to continue to be themselves in their most comfortable setting, their own homes.
How does someone get linked into this whole process?
Referrals are taken at a telephone number, which, with your permission, is 498-1558 in the 617 area code. And the House Calls program of the Cambridge Hospital services the Cambridge, Somerville, and some surrounding towns. But mostly focuses in the Cambridge and Somerville area.
And what is likely to happen once they are linked in? A doctor will make an arrangement to come out to visit, to do an evaluation?
The process is multidisciplinary, and that means that there are several different kinds of assessments that are done by a team of people who sit together, and then yes, a doctor or nurse practitioner will come and visit the patient at home and begin the process of developing the relationship with that person, to get to know them, and to, as Dr. Barron said in the piece, to get them to know them on their turf and in their terms, and to understand what's important to them in their lives, and to help tailor the medical plan to enable them to continue to do those things that are most important to them, and to empower them to be part of the medical care plan decision making. That's a very vital part to the success of the plan.
Now, where does the hospital fit into all of this? Is that part of the whole focus as well?
The hospital basically has been the spiritual center, in that they have given us the philosophical go-ahead to provide this kind of service in our community. And we're very fortunate in Cambridge that the Cambridge Hospital, which has won an award of its own as the #1 community-based hospital in the country, sees itself as a caretaker of the entire community, and not just as an acute care setting for the most ill people at a critical juncture in their life.
All right, a doctor's made the visit, he's made an evaluation, he prescribes, say, homemaker health care, perhaps some rehabilitation treatment as well, and then who makes the arrangements for all this to be done?
Well, we have a person who is at that number that I just gave before, 498-1558, who really is the center post of coordinating everything. Her name is Mary Hazard, and without her, I think the program could not have gotten off to this wonderful start that it's had over the past 8 years. She is a friend, a philosopher, a spiritual leader, a coordinator, and a good healthcare advisor in many instances. And she helps to connect all the pieces together, really. And
does the patient feel as though they can call her as well, or is it just the family members or the professionals that use that number?
I would venture to guess that if you polled our patients, that they would say that they know Mary better than they know anybody in the program.
How does house calls differ from the existing home health agencies that provide services, and the one that comes to mind is the Visiting Nurse Association?
Well, it differs in that it provides a coordination of services, not unlike the attempts that the Visiting Nurses Association makes with other doctors in other private practice settings. But the beauty of this program is that with the hospital's help, we have engaged all the community partners, the Visiting Nurses Association, a geriatric mental health provider, an adult daycare center, physical therapists, nutritionists, social workers, and we all sit around a table once a week to talk about the people that we care about most, which are our clients, and try to help continue them on that path which allows them to maintain control over their lives, a say in what's done for them, and as Dr. Hart said, to keep them out of the hospital, out of institutions, and with their loved ones.
I must ask you this. I know that there must be a tremendous amount of paperwork involved. Working in a nursing home myself, I know that with Medicare patients and Medicaid as well, there is documentation that takes so much time. I'm sure you people are subjected to that same practice.
Yes, I think it is said that nursing home practice is the most highly regulated of all the medical settings. Home care may catch up in the very near future. So there is a lot of office paperwork that needs to be done, but we do it as a team, and we get it all done. But really, we'd rather be out there taking care of our clients and with them in their homes.
We have a call from Ludlow, and Chris, go ahead. You're on Time for Living.
Yeah, I was wondering why young people with disabilities and mental disabilities can't get any services, because it takes a long time for any Visiting Nurses Association to do anything, and then doctors, I mean, there's so much doing other things that they don't have even time to talk to you.
We don't discriminate against people who are younger. It's really that this particular program began with a focus on older adults in the Cambridge and Somerville communities. We have several clients that we service in our program who are younger with disabilities. For example, we have a few clients with, one client with Down syndrome that I can recall, and a few with multiple sclerosis who find it difficult to get out to the physician.
But I hope, Chris, that you can find the services that you need and that you're looking for more easily than you have up to this point. Dr. Abrams, what about the costs involved, and how is it handled? Yes, certainly, Chris. How are costs handled in this kind of a situation?
Most of the home care costs are provided by Medicare, which of course is under great scrutiny right now, and we're all involved, or at least I am, and many people that I know are involved in trying to save the home care benefits that Medicare allows so that people can continue to receive these kinds of services. But there's a lot more to thinking about costs than just how does one pay for the visit. We believe that the program serves the clients in that it maintains their dignity and self-esteem, as the doctors had said, that it enables them to continue to do the things of value in their lives. But we also have looked at ourselves, and the house call program has been shown over the years to reduce the rate of hospitalization when compared to the general population of 75-year-olds by about 20%.
And certainly the cost compared to nursing home care.
And we've
question.
reduced permanent nursing home placement by over 30%. And those kinds of savings don't usually get included in the analyses that people do. But we think that we're doing a service for the clients, and a side benefit to that is that it happens to be very cost effective.
Thank you, Dr. Abrams. When we return, we'll be taking your calls for Dr. Abrams, and if you have a question about home health care, please give us a call. Our number at Time for Living is 617-244-3344, and we'll be right back. Welcome back to Time for Living. I'm joined here in the studio with Dr. Alan Abrams, and we're talking about home health care for older Americans. If you have a question for the doctor, give us a call at 617-244-3344. In fact, there's a call from Boston, and Elsie's on the line. Go ahead, Elsie, you're on Time for Living.
Dr. Abrams, I'm just overwhelmed with admiration about your program. But my question is, what will the push to get seniors to join HMOs do to your program?
Oh, that's
For
a
instance,
very good question.
even after I made the call, as I was waiting to talk to you, there was an advertisement from Secure Horizons. How will this fit in?
Well, I think that's an excellent question.
Does that put you on the endangered species list?
I hope not. I think it's an excellent question, and there are several parts to the answer. First of all, I think that HMOs respond to the customers. So I would suggest that all seniors who sign up for HMOs give a lot of feedback to their HMOs and let them know what their needs are, because they are there to serve you ultimately. The second thing that I would say is that since there will be competition among HMOs for seniors to sign up, that hopefully those that provide home care services will be more subscribed to than those that don't, and therefore we will not be the endangered species, but those that don't provide it will be the endangered species. And finally, I think that it's a great concern that when people sign up for HMOs right now, that there is not a provision in many of them, or in some of them, for home care services of the kind that's provided by the House Calls program.
I wanted to get that on the record.
We would, we would like to be involved in the development of home care for the HMOs, and we are working very hard in our system to develop contacts and relationships with HMOs to be able to provide this kind of service for them.
Certainly, if there's a cost effectiveness that you can show, this would be the possibility.
Well, I think that when we're talking to HMOs, talking to them about 30% reductions in nursing home placements and 20% reductions in hospitalization rates, and by the way, I didn't mention it, shorter hospital stays we've shown for those in the house call program who do wind up in the hospital. I think that that those are compelling. That's compelling news for HMOs. But I still think that of all the things I've mentioned, the most important thing is for older adults who are relating to these HMOs to stand up and be counted and say that they want these kinds of services. That's the way our healthcare system is going to remodel itself in a useful way.
Elsie, thank you very much for that call. It did provide the information we have to get at, and that raises the next question, dealing with what is happening in Washington, and if there is further refinement and cutbacks in Medicare, what will this do to HMOs?
I think that it's a very concerning issue right now. I think that older adults have to be very alert and aware of some of the changes that are going on and participate in the political process to whatever extent it is possible. Everybody's busy, but we all have voices, and we should get out there and let our voices be known. There is no doubt that as budgets are cut back for the health care provided to senior citizens, that everywhere along the line there's going to be a need to squeeze out more efficiency and lower costs.
Absolutely.
And that raises some important danger signals for older, frailer people who are dependent upon programs like the House Calls program.
Why don't you give us a couple of examples of the type of patient or client you have and the outcome?
We have a number of, all of the clients we consider wonderful, and some of the situations are extremely interesting and challenging. But just to name a few, last week on this show, people saw Anna Fenn, who's in her mid-90s and who just published her first book of poetry. She's a House Calls patient of mine. And without breaking the doctor-patient confidentiality, I won't talk about her medical problems, but I would say that it is, I think, a mutually delightful experience to work together to take care of her healthcare needs in a way that interferes most minimally with her moving on with her art and her poetry. We've had another patient that I take care of, has a number of chronic illnesses. She's an Armenian woman who's living in Cambridge, and amongst the problems that she has, one of the problems she has is that she has difficulty hearing, and it's very difficult for her to get out. And our program's in the process of arranging for her to have her hearing tested in her home so that we can get her hearing improved, so that then she can get engaged with other people, her family, and
have
get
a
her
more normal
socialized
kind of life.
and have a absolutely a more normal kind of life. Maybe a third example is an example of a woman whose 60-year-old daughter died several years ago, and she was left alone in her 90s, and the House Calls program was able to support her granddaughter and her grandson-in-law to put her in their home with her great-grandchildren who adored her. And she went on vacations with them, and she was able to stay out of nursing home for years.
So it was a quality of life that was totally improved upon.
It was a wonderful experience for the healthcare team as well as the family.
I think often about my own personal situation when we had to turn to home health care for my mother-in-law, and found that without it, there was just no way that I could have continued working or my husband would have continued working. So that it is of benefit not only to the individual, but to the total family as well.
This just reminds me of another point, just in regard to the previous caller and managed care. I think one of the major concerns in regards to managed care is that they manage the care from a distance often, and they decide whether services will or won't be provided, when actually it's the people who provide the care who really know what services need to be provided. And I think we ought to move the system in that direction so that people get the care that they need.
Once more, give us that number if people have more questions that they can call.
The number is 617-498-1558.
Dr. Abrams, thank you very much.
You're very welcome.
It's been very enjoyable. Dr. Abrams just finished telling us how older Americans can receive health care in their homes. But that doesn't mean that people should be homebound. It's important to get outside to get some fresh air and some sunshine. Now, we all know the damaging effects of the sun, and it can be very damaging. But as Time for Living's Steve Brown tells us, people who avoid the sun altogether are missing a very important benefit.
It's a fact. Vitamin D from the sun helps keep your bones strong. Just 15 minutes of sunlight a day will get you the vitamin D you need. 1 million homebound older adults, however, almost never get any sun.
For those individuals who get no sunlight exposure at all, the only source of vitamin D is through their diet.
A new study concludes many homebound residents have dangerously low vitamin D levels. That leads to muscle pain and weakened bones.
Brittle bones are more easily fractured, and understanding the cost of hip fractures in this country, anything that we can do to increase the strength of the bones and decrease hip fractures should be worthwhile.
There are alternate sources of vitamin D, such as milk and dairy products. Salmon and liver also contain high levels, but many folks won't include these foods in their diets.
A lot of them will avoid high cholesterol foods. Consequently, a lot of them will avoid foods that are also high in vitamin D.
Experts recommend vitamin D supplements for homebound older adults. They say the risks are few, but the benefits are great. I'm Steve Brown. Time for Living.
Welcome back. It's time for our Health, Finance, and More segment, where we feature experts to give you tips on money management, diets, health issues, and a whole lot more.
That's right. Every week we'll give you important information on issues that affect you, as well as solutions that can help you better manage your money or increase your self-esteem.
Today, financial consultant Steve Burke joins us again with tips on when it's a good time to cash in on your cash value insurance or annuities, or more importantly, when you shouldn't.
Today, I'd like to discuss some dangerous financial activities which retired people or those about to retire sometimes get involved in. I'm referring to replacement of existing cash value life insurance or annuities, which some of you may have had for 5 to 10 or even 20 years. There are exceptions to every rule. Sometimes it is proper to replace a life insurance policy or annuity which has cash value. But never do this unless you know it serves your needs and how the new policy compares to your existing insurance. An example of how this replacement approach works might be helpful. A person age 64 has had a $50,000 cash value life insurance policy for 20 years. The cash value of the policy is about $20,000 and the premium is about $1,200 per year. The question is asked, how would you like to have the same $50,000 worth of insurance for the rest of your life without paying any more premiums? Or would you like to have more insurance coverage and still pay the same premium? The natural response would be, I'd like that, but beware. The theory behind this plan is that interest rates in the new replacement policy will pay to maintain the original insurance coverage, or the increase in the new coverage. While that is a possibility if interest rates perform as projected, it is not generally guaranteed. I use the word guaranteed because that's what you should be looking for. If you're going to entertain the idea of replacing what you presently have, in the example I've just mentioned, the guarantee of coverage would last for about 15 years, or until the person is 79. If you don't want any more insurance after age 79, you're fine. But if you do want protection, you could face a problem. The problem is that the insurance company might very well ask you at age 79 or thereabouts for more money to keep the policy in force. So what do? Nothing, until you've had a chance to evaluate your need for life insurance, as well as compare the options and guarantees between the new policy and the old. It is not a fact of life that you will need the same amount of life insurance for the rest of your life. You may, but it's best to do an up-to-date estate plan to get a good idea of your requirements. There are certain final expenses which generally can be anticipated, such as funeral bills, estate and inheritance taxes, as well as income taxes. Also, other financial responsibilities, such as income to a spouse or other dependent, should be considered. Then you have a good idea of whether, in fact, you need as much insurance as you have, or maybe, because of taxes or other financial exposures, even more protection than you have. Most cash value policies provide alternate strategies to the insured. As an example, you generally can have a reduced paid-up policy, which is what it says. Less insurance coverage, which is paid up and requires no further premium payments. Or extended insurance. This extends the same coverage you presently have for a period of time in the future. No more premiums. Additionally, you can cash the policy in for money to use in other areas if you don't need as much insurance, or turn it into an income source for yourself and your spouse by annuitizing the cash in the policy. In short, you may well have many options with your present insurance coverage, which allows you to benefit yourself without changing to a new policy. Remember, too, that starting a new policy puts you back in the contestable period of the new policy, and never drop existing insurance until you are satisfied that the new coverage is in place properly and responding to your needs. Guaranteed. Remember, there are a lot of good people out there ready to help. Like any business or profession, there are a few bad apples. So ask lots of questions, look for guarantees, and believe in your own judgment. You didn't get this far in life by being a dummy. I'm Steve Burke, Time for Living.
If you'd like more information, you can write to Steve Burke, care of Time for Living, Post Office Box 1698, Framingham, Massachusetts, 01701. Or you can call our voicemail number, toll free at 1-800-232-7213. Now, if you didn't catch our address and phone number, get a pencil and paper ready. We'll repeat it again later in the show.
Next on Time for Living, our Traveling Around segment. Get your passport ready. We're taking you to Portugal, Spain, and Morocco. Please stay with us. Prompter. All set. We on camera too?
Very much alike. Both graduated from college and started their careers at the same time, filled with ambitious dreams about the future. But as you'll see, there is a difference. It isn't intelligence or talent or dedication. It isn't that one person wants success and the other doesn't. The difference lies in what each knows and how each makes use of that knowledge.
Welcome back. It's time for our weekly Traveling Around segment.
Every week on Time for Living, we'll tell you about an exciting vacation destination with the older traveler in mind.
Many older Americans find they now have time to see the world and set out to explore different cultures.
Today and in the weeks ahead, we'll be giving you some food for thought when it comes to traveling around.
Speaking of food, you'll find some interesting cuisine in Portugal, Spain, and Morocco. And that's today's Traveling Around destination. Make sure your bags are packed and your passport is up to date because you're going to need them on this trip. There's a lot to see and do on the Iberian Peninsula, especially for older travelers. First stop on this trip, Portugal. With its long Atlantic coastline, it's no wonder Portugal has been a maritime nation for most of its history. Portugal is small enough to be seen during a short visit. But as Carol Clark found out, there's a lot to see.
One of the most exciting parts of the trip to Portugal was a chance to see the Lipizzaner, the Spanish horses that are trained, and the bulls being in training. There, the heifer came charging out of there. She's probably sitting in the field with Ferdinand, both of them smelling the flowers and saying, "Not for me to be a bull."
Portugal has much to offer travelers: fine beaches, beautiful castles, and charming fishing villages. It remains relatively undiscovered, unlike its larger neighbor, Spain. Spain's Costa del Sol offers tourists several luxury hotels to choose from. And if you'd like to sample delicious food, this is the place to go.
One of the things I like to learn about are the different recipes using the same ingredients that we're used to at home and turning out a totally different dish. It's been a part of my life. My father was a fantastic cook, and I have taught cooking for 26 years.
Yeah, one, right. Yeah. Sí,
yeah.
Una persona mayor.
Yeah.
Pa uno. But, y baby.
Little.
Baby.
Ah! And one Sandy.
Dos.
Yeah.
Dos babies.
Two.
Baby.
Two babies.
No.
Two hand.
Toda.
Whole hand.
No measuring cups.
No measure.
Okay, so the shrimps are going in raw. Don't cook them first.
Leave the heads on.
Yeah.
The flavoring.
Staring at me.
Well, that's all right. Just say, you have received absolution.
Yeah, these have been boiled, huh?
Look how pretty she makes the pretty design.
Yeah, set out like a little star.
That's why normally a cook here always shows the paella when it's ready. They bring it. They show it like that at the table.
Oh, and then take it and serve it. Ambrosia. More? I'm living in Spain.
Just a ferry ride away is exotic Morocco. Very different from Portugal and Spain, Morocco is on the northern coast of Africa. The highlight of Carol Clark's stop in Morocco, a visit to the spice market.
This one is it looks like a freshwater chestnut. It's dry, or sea urchin, dried sea urchin. I don't feel by myself it would have been safe for me to go in, and I'm a pretty adventuresome person. And I would never have gone there without a competent guide.
There are travel packages available which include Portugal, Spain, and Morocco. The only complaint about the trip is it leaves you wanting to go back for another visit.
Someday I want to come back again to Spain to see the northern part, and I definitely want to go back to Portugal. You never see all the things you want to see on the first go-round.
We'd like to thank Grand Circle Travel for providing us with that video tour of Portugal, Spain, and Morocco. And if that seems like a trip you'd like to take, well, you can write to Grand Circle Travel, and they're at 347 Congress Street in Boston, 02210. Or you can call them toll-free at 1-800-221-2610. And if you know of a great travel destination for older adults, please tell us about it so that we can feature it on an upcoming Traveling Around segment. You can write to Traveling Around, care of us at Time for Living, Post Office Box 1698, Framingham, Massachusetts, 01701. or you can call our voicemail at 1-800-232-7213 or fax us at 617-329-1774. Coming up next, the man who created the most famous bear in the forest. Stay with us.
Just because you hit the age of 50 doesn't mean you're over the hill. Most older Americans are leading active, productive lives.
Some folks don't know the meaning of the word retirement, and there are people that we'd like to profile in our second effort salute. People who, through persistence and determination, continue to make a solid contribution to society.
The phrase, "only you can prevent forest fires," is as familiar as the face behind it. But less well known is the artist behind that familiar face. Time for Living's Rod Fritz introduces us to an 85-year-old retired U.S. Forest Service artist who's adopted the role of Smokey Bear's guardian.
They've been the best of friends for years. Rudolph Wendelin and the forest ranger who needs no introduction.
I like to put a kind of a friendly look on him, although he has a serious message.
It was 50 years ago when the U.S. Forest Service first assigned Wendelin to tame the image of Smokey Bear, who was more like a wild animal.
He still needed a conversion, a metamorphosis from an animal figure into a more humanized figure. And that's where I contributed little by little here and there.
Wendelin gave Smokey fingers instead of claws so the bear could hold a shovel, and he made Smokey's eyes more human, and he softened his snout.
According to the song, it says he can smell a fire before it starts to flame. That's why they call him Smokey. That is how he got his name.
In his basement, Wendelin keeps many of the posters and the paintings that he's created over the years. Through Wendelin and other artists, Smokey has become one of America's most beloved characters, extremely popular with children.
Here's one where he's reading his fan mail.
Wendelin retired from the Forest Service more than 20 years ago, but he remains Smokey's guardian. He's established a non-profit foundation and organized a national touring museum of Smokey Bear history and memorabilia. Wendelin says that's the least he can do for his old pal.
I just feel a real sense of responsibility to this character. To me, he's always been somewhere down the hall, somewhere controlling the whole operation, and I feel very close to him.
I'm Rod Fritz. Time for Living.
Now, if you know of someone deserving of our second effort salute, please let us know. Drop us a line at Time for Living, Post Office Box 1698, Framingham, Massachusetts, 01701. You can also leave a message on our voicemail toll-free at 1-800-232-7213. And our fax number is 617-329-1774. If you missed our address or phone number, don't worry. We'll give them to you again later in the show.
Up next, we dip into our mailbag and take a look at your letters, so don't go away. We'd like to thank you. So many of you have written to us to find out about our show and talk about how much they like it.
You know, you've told us that you're having a show on television that deals with issues that interest you, and a program that shows older Americans the way they really are, full of life and energy, with lots more to contribute to society.
Now, this is the segment of the show where we'll read some of your letters on the air. And let's see, I have the first letter here. Jay of Boston sent us a note that reads, "Dear Janet and Rex, it sure is a pleasure to have you both back. We elders need representatives, and you both are perfect ones. I enjoyed your first appearance, and may you have many, many more." That was Jay from Boston. Thanks very much.
That's right, and we do hope that that's right. Our next letter comes from Madeline Winbush of Mattapan. She saw our first show and the interview with Dr. William Milberg on the topic of Alzheimer's, and she was wondering about the eye test to help identify Alzheimer's patients. She writes, "What kind of doctors would I see to have this test taken, or is it available yet?" She adds, "I believe that my mother and aunt had Alzheimer's. Am I a candidate?" Well, Madeline, we passed your question along to Dr. Milberg, and he tells us it is an experimental test being conducted at the Brigham and Women's Hospital by Dr. Kurt Daffner. And Madeline, it's best to consult your own doctor about your concerns. When we return on Time for Living, we'll take a close look to see at what's coming up on next week's show, but I think it's important to tell you, too, to keep those letters coming.
Well, it's great of you to join us. And by the way, Janet, I think it's very important for our folks and the people who join us every week, and I hope they will join us every week, to realize this is their program.
That's right. And you've got to tell friends about it so they can call and get involved in the program as well. That's what it's all about. That's why we encourage you to write letters and to get involved in the program in some way.
That's right. By the way, if you will tell a friend who will tell a friend who will tell a friend, the word can get around. Yes.
I was wondering, is there a prize at the end of that?
Well, there'll be a prize because we always have something to offer right here on Time
That's
for Living.
true. I've learned something each week that we've done this program, and it's 3 weeks now, and I just know that you too are learning from what we're sharing with you. If there's a topic or a subject that is of extreme interest to you and you want us to explore it, we'll be very happy to do just that. So please keep that in mind and send us your cards and letters and let us know just what is really urgent and important in your thinking.
And remember about the various segments that we have. We can tell you about money and finances. If you have any questions about that, we'll give that to Steve Burke to fill you in on. We also have that traveling around segment, so if you have been to a very enjoyable place and you'd like to share that destination with our audience, tell us about that.
Sure.
This is your program. We call it interactive television. It's a very important thing.
I also think that we learned a great deal from Dr. Alan Abrams today about home health care and about house calls. I think this is an area that is of growing concern to so many of us, not only people who are older in age, the people who are frail and elderly who are concerned about the future, but the children of these people. And I put myself in that category. You've got to be concerned about how to plan for the future. And so I really believe that Dr. Abrams shared a great deal of very valuable information with us. If that's a topic that's of greater concern to you, please explore it as fully as you can, and we can provide you with as much information as you need. So never hesitate to pick up the phone or drop us a line.
You know, it's amazing the way finances tie right in with what you're talking about, home health care. Many Americans, I think it's over 80%, want to live in their homes
That's right.
for the rest of their life. How do they do that? Because they're always afraid of running out of money. And if they run out of money, they have to sell their house. How can you have home health care when you run out of money? And so Steve Burke may be telling us a little bit more about that and telling us how you can live in that house until
That's right. And there are lots of creative
Whenever.
ways to finance this sort of thing. So we hope we can bring a lot of this information to you in the very near future. I think it's also exciting to see what many of our elders are doing and leading in such productive lives. We've featured several of them, and if you know of any, by all means, please do let us know about your neighbors, perhaps, or relatives who are doing incredibly unusual things as they grow older. It's not a time to quit. It's a time to just keep on coming.
Well, thanks so much for joining us again on Time for Living. We hope you've enjoyed this week's show.
Indeed, and please join us again next week right here on New England Cable News.